All right, welcome to week 2, module 2. This is a synthesis of Claywell. I'm just going to share my screen here. All right, so that way you guys can see what I'm talking about. So remember, with these micro learning lectures, I will give just a quick synthesis of the chapter. So each chapter will have a problem associated with it, a test question, so that way it can test your knowledge, and then just a brief overview. So it is your job to read the PowerPoints, read your chapters, take notes, and grasp the important critical information from what you can gather. All right, these are the learning objectives. All right, let me click here. So just remember, I want you to keep an open mind because as an LPN, you probably reported abnormal labs, vital signs, etc., to your charge nurse or to the healthcare. As an RN, you will learn to modify shape and add more information, which will enable you to act and make recommendation for improved patient outcomes. Remember the R from SBAR, that means recommendation. It stands for recommendation. So your healthcare practitioner actually wants your information as registered nurse. So on orders that you might need, medications you might need for caring for your patient, recognize also that if you're still working as an LPN throughout this program, there can be a role conflict in learning and modeling the role of an RN. But I want you to embrace it and practice it in simulation and in lab, right? As an RN, you are the care provider, the counselor, the educator, the manager, the advocate, the collaborator, the change agent, the role model, the mentor, the researcher, and the entrepreneur, right? RNs have a higher educational level with the why versus the how. They have critical thinking deeply using pathophysiology, independence. You're autonomous as a registered nurse. You have critical assessment skills. You can do care planning. There are legal and leadership responsibilities as well. You can do IV therapy is a big one. Am I sharing my video here? Let me just see. There we go. All right, so that way you guys can see me. So you can do IV therapy, communication and patient teaching, patient education, and that is all the part of the RN. RNs can also further their credentials through the American Nurses Credentialing Association. An overview of Chapter 4. Just remember here, let's go to Chapter 4. Okay. All right, so with Chapter 4, so this is an overview about Michigan. So Michigan does not have a standalone act called the Nurse Practice Act, because in Michigan, we have a consolidated occupation that covers about 25 health occupants. It's titled the Occupational Regulation Section of Michigan Public Health Code PA 368 of 1978. The Public Health Code describes your practice as an LPN, an RN, or an advanced practice nurse. Only a few states do not have the Nurse Practice Act, and we happen to be one of them. We also do not have a compact license, which allows you to practice in several different states. So if you're licensed in Michigan, you can only practice in Michigan. The American Nurses Association, the ANA, also defines the RN scope and standards of practice, with 6 standards of practice such as assessment, diagnosis, outcomes identification, planning, implementation, and evaluation, and 9 standards of professional performance, ethics, culture, congruent practice, communication, collaboration, leadership and education, evidence-based practice and research, quality of practice, professional practice evaluation, resource utilization, and environmental health. There is 4 key elements of the Institute of Medicine's report from 2010 that are about RNs, registered nurses. They said RNs should practice to the full extent of their education and training. They should achieve higher levels of education and training through an improved education system that promotes seamless academic progression, and be full partners of the healthcare professional team in the United States. So let's go to the next one. So there's your question. All right, so chapter 6 is patient-centered care using the nursing process. So the 5 steps that are identified in the nursing process are assessment, which is subjective, and objective data, diagnoses, outcome identification, planning, implementation, and evaluation. So nurses' problem-solving method combines the art and science of nursing. Problem identification has replaced nursing diagnoses. So we don't use nursing diagnoses. Remember the 6 steps of clinical judgment. They are cue recognition, filtering data from different sources such as history, physical, signs and symptoms, vital signs, analyzing cues, which is organizing and linking those cues from cue recognition to the client's current clinical presentation. Start establishing client needs with the analysis of cues, problems, or concerns. Then you're going to go to hypothesis generation, which is evaluating and ranking those hypotheses to prioritize, such as urgency, likelihood, risk, difficulty, time. Then you're going to generate solutions or nursing interventions. You're going to identify expected outcomes and using those hypotheses to define that set of intervention for the expected outcomes. Then finally, you're going to take action, implementing those solutions that address the highest priorities. Recognize that no action is inaction in itself. Evaluating outcomes, which is the last step of the 6 steps of clinical judgment, where you're going to compare observed outcomes against expected outcomes. Next, you're going to answer the question, next question here. So this is the next question you're going to answer. And then we're going to be on chapter 7. Okay, so this is the last chapter in Claywell, which is chapter 7. And that is critical and improved clinical judgment. Well, I just gave you the 6 steps of clinical judgment prior, but clinical judgment is a combination of problem-solving abilities by the novice nurse to develop and evaluate nursing interventions and critical thinking skills involving logic and reasoning. The above activities, such as cue recognition, analysis of cues, developing and evaluating hypotheses, and identifying and implementing nursing interventions, and then assessing those outcomes. So when you're doing this, you need to think out loud. That promotes higher order cognitive skills. Application level is the level that you're going to be receiving exam questions, right? And that's the use of facts, rules, and principles. Concepts to activities for application are apply, compute, conclude, construct, and demonstrate, determine, draw, find out, and give an example. Illustrate, make, operate, show, solve, state a rule or principle, and use questions like, how is this an example of this, question mark? How is this related to this, question mark? What is this significant, question mark? Do you know of another instance where, question mark? Could this have happened in, question mark? And as a learner, you also have to evaluate the effectiveness of your teamwork and collaboration. Scope of practice in the appropriate role delegation among health team members. And remember that you're going to be doing this in simulation. So you're going to change roles in simulation as well. So question 3 is critical thinking and improved clinical judgment. So answer the question on your Word doc. Just posted for module 2. And then finally, these are the learning outcomes that you should establish. Thank you so much. All right, next chapter.